Fantastic. Okay, so good afternoon, students. So today we're going to learn about electronic claims in chapter 8 of the Fortney book. So I'm going to erase this. Oh, excuse me. Okay, let me put this over here because I don't know if this one right. Is this one? Oh, I like that one. I like that color too. I'm not going to steal it. Looks different, but I'm not. Okay, so we're doing chapter 8. Electronic claim form. Electronic claim form. Okay, so now what is the electronic claim form? Glad you asked. The electronic claim form is done through EDI. Okay, so that's right there. Okay, so it's done through EDI, and it's done through what we call electronic data interchange. Okay. Electronic data interchange. And what that is that claims the CMS 1500. The CMS 1500 is used as a virtual soft copy to have claims processed by way of the internet. Okay? All right. So when it's done like that by way of the internet, so that means that there's no longer a need for you to do paper claims, hard copies, if you will. There's no need for you to do that. So you put it on there and you're going to see the virtual picture come up and you're going to fill everything in as you need. Now, what ends up happening is it doesn't matter what software you're working on. It could be Epic, it could be eClinicals, it could be Alliance, it could be ZocDocs, other billing software, Medisoft. That's pretty popular. Those softwares that are out there, and how all that plays a role and comes together is everything takes place at the front office. Everything takes place at the front office. So let's write down that process, okay? So I'm gonna write that down in this nice tan color marker, kind of like that. I want to steal it. Tempting. I do like markers. However, so patient demographic. Okay, patient demographic forms, okay? So that needs to be completed by the patient. Once that's completed by the patient, then the patient gives it to the front desk clerk. Okay, front desk clerk. Okay, front desk clerk enters in all the information from the front desk clerk. Once she enters all that in, so patient demographics, we'll come back and visit that. Then it goes to the coder, and it depends on how the office structure of the practice is set up. Not all physician practices office structure functions the same. You have some that wear more than one hat. You have some that may be the medical biller. You have some that may be the insurance verifier and the front desk person. Depends on how big the practice is, how small the practice is, and the feasibility of paying for those employees to do the job, okay? All right, so it goes from the coder. So this is just an ideal format. It goes from the coder and then to the biller, okay? And from the biller, if the doctor so chooses, and I'm gonna come more over this way, okay, to the clearinghouse, okay, we're gonna talk about what a clearinghouse is, to the clearinghouse, and from the clearinghouse, so the purpose of the clearinghouse is to scrub the claims, okay? Then from the clearinghouse to the insurance company, okay? Now, insurance can be Medicare, okay? Medicaid, okay? It could be commercial insurance, okay? So you have your commercial insurance, such as one is Aetna, okay? You have United Health, you have Blue Cross Blue Shield, you have Cigna, you have Marina Health, okay? So on and so forth, okay? Humana, that's number 6, Humana, okay? So on and so forth. However many is out there that are participants of the clearinghouse for them to receive the scrubbing of the claims. So now let's break down the process of this, okay? This is a short version of what I call adjudication of the claim. If you understand adjudication of the claim process, then you pretty much understand a billing and coding, okay? And somewhere in between, in the midst of all of that, you're going to understand your job, okay? So now, once all of this has been done from the insurance company, then the insurance company, it doesn't matter who, the insurance company is going to give a response. Okay, give a response. Okay, and that response to that claim, let's move this over. The claim is going to be what? What are the 3 responses that insurance company talks about? Okay, can anybody tell me? Do you remember? Paid. Okay, I'll give you another clue. Pinned. And what? What is it? Deny. Okay. Pay, pin, and deny. Those are the 3 things that will be responded to on an EOB. EOB means explanation of benefits. Pay, pin, or deny. Now, I said the last time on the lecture that for every EOB, there are message edits, okay? And on those message edits, they will tell you, okay, the claim is pending for medical records. The claim is pending for coordination of benefits. The claim is pending for proof that the child is a full-time student. Although he is on mom and dad's insurance to the age of 26, he must say that he's a full-time or part-time student or half-time. He's got to show proof of his, how can I say, school registration, that he's registered in school. Okay, not registered in school and intend to drop in the middle of the semester, because they can audit a question anytime they want to. They can audit that question in September. They can come back and audit that question in November. They can come back and audit that question in December. I rest my case. Okay. Pay, pin, or deny. Those are the 3 responses. Okay. Now, depends on what the edit messages are, and not all edit messages going to have the same exact numbers for all insurance companies. They make up their own. I see that you're shaking your head when I said that, and you shook your head no. So you agree with me. That means you've been paying attention. Thank you very much. Okay, so if you get a bunch of them, I said this before, when you organize your edit messages for the day, and you're a person that's going to do the correspondence for the insurance companies, You're the person that's going to find out why all the claims are being denied. You're going to get a stack of all denied claims. Why all the claims are being pending. You're going to get a stack of all the edit messages from the insurance companies, the EOBs, that says claims are being pending for such and such reason. Then you're going to get another stack, all the claims with the EOBs that says pay, 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 pay. Now, all the ones that's being paid, you're going to now start posting payments. That's your job. Accounts receivable. We talked about that last week. Did we not talk about that last week? Okay, thank you very much. We talked about that last week. Your job all day, 24/7, that's what you're going to do, is accounts receivable. You got to post payments. Once you post payments, if there's any residual balances, if it needs secondary billing, we talk about the job being a secondary biller or how to reproduce billing on a secondary level. Then you need to reprocess that claim with the EOB from the first insurance company to the second insurance company with a fresh new HICFA or CMS 1500 form electronically. And you need to attach that EOB that says, we pay such and such a Cigna. Now, Humana, you're going to pay, or you can take whatever you want to do, look at how we pay, and then you can adjust what you want to pay according to your reasonable and customary services of what you do at your company. That's how that works. Okay. Now, once all that's done, once you post payments or you've done your secondary billing, because being a secondary biller is a second job. And again, it depends on the influx of patients, how big the practice is, how consistent how can I say, person of need is to do that one particular job. And every now and then she may have to mix hats and kind of help out here and there. Then once she does or he does the posting of payments, now you need to do your collections. You need to either make phone calls or you send out 30, 60, 90-day notices. So you're going to start sending out a bill to say, okay, Mr. So-and-so, Miss So-and-so, your insurance paid this, you owe that. Although we got acknowledgement that you paid your co-insurance, you paid your copay, but the residual of what your insurance didn't pay, minus your copay or your co-insurance, minus what they pay, and the contractual rate of what the insurance will pay, the residual of the bill is for you to pay. And so we need you to pay that. Okay? So if they don't respond in 30 days, now you need to make a phone call within the first 20 days after sending that bill. And then if they're not responding, then you need to send another letter out saying, hi, we're contacting you again, la, 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 la. And sometimes you can go 30 days, 60 days, 90 days, 120, 180. Then you have to make a decision because they sign that paperwork in those demographics that they are financially responsible. And because they are financially responsible to any residual amount, that you have that right to, but due to credit collections, and it depends on how the medical lawyer or a lawyer for that physician's practice or that physician's business or the civil lawyer, depends on how they write up their document, they can sell your information to a collection agency for them to collect. And they sell it for a certain amount of price. And then they try to collect the money, and then they're going to make the collectors make bonuses of how much they can work with you to get you to pay to zero out that account or to pay down on that account. Okay, that's a whole nother genre of accounting conversation that we could talk about later. Maybe I'll have one of my accounting consultant to come in. She has an MBA like me, and she can go deeper about that accounting type stuff. That's kind of not where I want to go. Okay. I'm more into revenue cycles on the healthcare side, but not that deep. Okay. All right. So now this comes one of these three situations right here. Now, when it's finished from here, then this is going to be sent back to the doctor's office. Okay. So once it comes back to the doctor's office, then that means the accounts receivable person will either do their job. Okay. The collections person will do their job, especially if it's dealing with payments. Especially if it's dealing with payments, okay? Now, if it's dealing with denials, then you have to read what that edit message is saying about denials. Some denials are appealable, okay? And they're appealable if it's something that maybe you forgot to add a modifier and it denied because you did not add that modifier to justify or to give an adjective as to why that procedure code is being utilized. So that's what a modifier does. It brings extra information as to explain why are you using this particular CPT code, okay? Sometimes it could be denied for maybe you clicked the wrong family member. You know, it's for this daughter, not that daughter. It's for this son and not that son. It's for this father and not that son. It's for this daughter and not that mother. You know, you got to be careful in billing. It's great when you have production and it's well needed to know how much revenue is being brought in daily, weekly, monthly. And when you have that end of the month meeting, that physician needs to know how much money did you bring in? How much is lacking? Okay, what are we going to do? What's the plan? What's the goal? What is needed to achieve the goal? Okay, all those kind of things matter. Okay. So once it comes back, you have usually a 2-week, 14 business day window to appeal. Okay. Sometimes the statute of limitations may say that you have a 2-year window. It depends on the insurance policy and plan to appeal. Okay. So please know your policy and laws in your state and according to what insurance company that you're doing this for. Okay. All right. All right. Now, once it comes back to the doctor's office, then you need to do this. And then once you do this, pretty much the cycle starts all the way back over. Okay. Now, if it's the front desk deal with this, if it's a new patient, okay, if it's a new patient for an office visit or a consult, okay. Now, if it's at the doctor's office, then it's gonna just sit right here till the next appointment, okay. Now, let's write a different color, okay. Now, from the front desk, sometimes you may have people that are what they call appointment setters. Appointment setters pretty much just set appointments. They're the ones that do the cancellations. They're the ones that will block out time for a doctor to go to a meeting or the doctor to do his rounds at a hospital, or the doctor may do certain days of his surgeries and stuff like that. The doctor may go on vacation. Appointment setting is very critical to the billing. Why is it important to billing? It's because it's called checks and balances in the accounting world. Okay, if you have so many people that have made appointments, and it doesn't matter if they were fee for service, insurance, workers' comp, whatever. When you get through balancing out for that week, it better balance out for that week and how many patients. Then that gives you an idea of what the billing amount should be for that week. Okay, checks and balances, appointments, billing. Okay, you got to make sure it adds up, because if you're expecting $10,000 worth of revenue that day, and this is saying $5,000, you're gonna have to kind of like figure out where's the other five. Is it pending? Has it been denied? If it's paid, how much? Okay, why they pay it like that? Do I need to resubmit the claim? You know, do I need to resubmit it for an appeal and send copies of the electronic medical records so they can reevaluate how they're paying this? You can't up code, you can't down code. That's against the law. You will get cold busted. Okay, cold busted by the OIG, Office of Inspector General, baby. Okay, that's how it goes. Okay, now appointment setter. Now, along with the appointment setter, you may have a person that's called an insurance verifier. Okay. Now, the insurance verifier. The insurance verifier sits there and verifies the insurance. Okay. They got to make sure before that patient comes in, are they still eligible for benefits? Okay. And this is all in chapter 8. Now you're probably wondering, okay, Ms. Harper's not looking in the book in chapter 8, blah, 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 blah. Why? Because I've been teaching this since 2003. I've been in education since 2001. I've been in the field 32 years. I know what's in the chapter. Okay. Insurance verified. They got to make sure that your claim or your insurance has not been terminated. If it's been terminated 2 days prior to you coming in, then they need to say, Mr. or Mrs. So-and-so, your insurance has terminated. Do you have any other insurance for coverage? If not, the possible visit cost may be $300, and that's not including any lab or x-rays that you may need. It's just an approximate for the office visit by itself. Or it may be $100, or it may be $150. It just depends. Okay. And you're gonna have to work that out. And if you have a good relationship and you have a good rapport, a good relationship, you've been seeing the doctor for a period of time, you can work some things out with the office manager or with the practice manager and with the physician. And they'll say, okay, but we need to keep, sometimes they will say your credit card on file, your debit card on file, and what day can we run the card, so we can make sure we get a certain percentage, because we already know you're a frequent flyer with us in our office. Okay. You come in here pretty frequent. Okay. All right. And there's nothing wrong with that. Keep it real. We live in a real society, real economy. Everybody don't have it like that. Some folks do. God bless us. But those that don't, hey, you still need health care, sweetie. Closed mouth don't get fed. Open your mouth and tell them, hey, work with me. And be honest. Don't lie. Be honest and hold to your word. Okay? All right. So appointment setter, insurance verifier. What's the next one? Okay, you have documentation specialist. Documentation specialist. Okay. Which is more or less like your electronic medical records person. Okay, there's a difference between electronic medical records. I know, I'm sorry.
I just walked up.
I know, you had to catch yourself. I know. Electronic medical records, electronic health records. I'll explain that in broad terms what that is. Okay, so understand that when you are doing patient demographics, make sure you get all the information. And yes, the patient has to give you their social. They have to give you their social. Okay, we need that. Because the insurance company may not have your subscriber ID or your policy number correct. So we got to give them your social so they can make sure that we're finding and talking about the same person. Okay? Okay. Now, I know I'm sounding rough because there's a certain dogma of how I teach. Okay? There's a certain moxie. Hey. Did you? Where? Oh, that's you on the screen. Hey, okay. She showed me that's me. That's me. Okay, fantastic. Thank you. Thank you. Okay. But I teach with a certain dogma and a certain moxie, if you will, because I'm bold like that. That's just who I am. Okay. All right. So now we understand the adjudication of the claim process. Okay. When you understand adjudication of the claim process, you pretty much know where the ball has what? Dropped. Okay. So now let's get to the book here. Let's kind of understand some terms in the Fortney book. This is the Fortney book that I'm teaching from. Ooh, I cut my nails. They've been broke, so I had to cut them all off. I showed you I had to do that. Okay. And so we're doing chapter 8. So we talked about electronic data interchange. Encryption. Read the question about encryption in your book. This is 8-1 review questions. Sorry.
No, you're fine. Oh wait, no, the question's not on there.
In your workbook, sweetie.
It is?
Yeah, in your workbook. 8-1. That's okay. Oh, you've been working on it. Bless your heart. Okay, yeah. Go ahead.
Exchange of data in a standardized format through computer systems is a technology known as electronic data interchange.
Okay, and what's number 2?
The act of converting computerized data into a code so that unauthorized users are able to read it is a security system known as encryption.
Encryption, okay? So whenever you're sending things, make sure that your software in your doctor's office, the software that you use, that you may do some remote medical billing, make sure it has a good firewall, a good antivirus on it. I can't recommend any right off the top of my head because I'm not an actual IT person. You would have to ask a professional IT person or shop around Google and ask. Or you can ask a local competitor. But make sure that your stuff is protected so that, you off my page? You signed off?
No, that was someone I knew.
Okay. Okay. What was it, sweetie? Encryption. So make sure it's protected. So you can protect patient health information, PHI, patient health information. Okay, it's really important because you got these software pirates, these internet pirates, and they try to hold captive of people's information and trying to hold them captive for ransom. Okay, which is kind of crazy.
Do they give you, like, say you work from home, do they give you, like, certain websites that are, like, you said encrypted to where that you sign in?
Yes, they do. They do. So if you work for an actual software company or even as an insurance claims examiner, they're going to give you their computer, their desktop or laptop, their materials rather, to work with, and everything is already set. Everything is already in safe mode, so that you cannot pose harm to the patient's information. Okay. It's a very good question. Very good question. Thank you for asking. Okay, read number 3 and 4.
Payment to the provider of service of an electronically submitted insurance claim may be received in approximately 2 weeks or less. And then medical practices that do not use the services of clearinghouses submit claims through a direct link to the insurance company.
Okay. Direct link through the insurance company. I'm glad you said that. Okay, so payment or response time should be within 14 business days. That's 2 weeks. Okay, not calendar days, business days. Okay. Now, direct link. Let me give you an example by how that is. Okay. So can I erase this? Okay, fantastic. Yeah. Okay. Now, I'm writing blue. Okay. Okay. So let's suppose we have Blue Cross, Blue Shield, and let's say we have Aetna. Okay. Let's say we have Cigna. Okay. Aetna, Cigna, Blue Cross, Blue Shield. Okay. So they have their web link. Okay. They have their web link. Okay. And they have their web link. Okay. Now, the providers for each one, the providers are the doctor's offices, the nurse practitioner, the physician assistants. they're supposed to have their own login and their own password significant to them. Okay, significant to them, so that when they sign on to Blue Cross Blue Shield, and let's suppose by example, we'll say Dr. R.B. Smith. I don't know a Dr. R.B. Smith. I'm just saying a Dr. R.B. Smith. I'm just making up names. So don't get on my channel. Don't get on my YouTube talking about Miss Harper was talking about Dr. R.B. Smith. I don't know who Dr. R.B. Smith is, okay? Don't step to me with that, okay? I'm gonna tell you right now, I'm gonna set you straight. Okay, now, here on the web link, and let's suppose Shay. I don't know a Shay, but let's suppose Shay logs in. Okay, she's gonna log in because she works for Dr. R.B. Smith. Okay, so Shay is going to look for all the claims significant to Dr. R.B. Smith. Okay, they're going to have all their data service, DOS. It's going to have all the CPT codes listed. It's going to have all the EOB edit messages. Okay. Diagnosis code, sorry. Excuse me. Okay, DOS. DOS means data service. Okay, so you're going to look, you're going to scan these. This is what you're doing. You're scanning these. Okay, you're scanning for a follow-up. Okay, 2, follow up on a claim. Okay, you scanning to see how the claims are processing. You're scanning to see are there any pended claims. Sometimes they're pended before they're released to with an art before they're released into the system to the response of the physician's office, or sometimes they're pended in suspense until further notice by the claims examiner or the adjuster. Okay, pended. So what you're doing is you're tracking, you're scrubbing. Okay, this is another form of scrubbing. You're scrubbing. So you may have an accounts receivable person to do the scrubbing for this. So let's write this down. Here's how you better spend your time. If you're going to scrub, you're going to scrub 2 hours here. You're probably going to scrub 2 hours here. And you're probably going to scrub 2 hours here after lunch. This is before lunch. This is after lunch. Now, what is Ms. Harper saying? You don't have time for Facebook, LinkedIn, Snapchat, Instagram. What's another one out there? Twitter. What's another one? One of them media. Facebook. You don't have time for that. Your job should be about this. If you're doing 2 hours of this and 2 hours of this, you need to go to lunch. Yeah. When you come back from lunch, you need to pick this up another 2 hours. You need to be scrubbing. If your job is scrubbing, then you need to be scrubbing. Now, what I mean by scrubbing, you need to print out all the claims. They got ways where you can print out all these claims, and you need to mark off what you did, and you need to have a sensible production. Now, let's suppose if it's a practice with 3 physicians. Okay, let's go one. Maybe you working for a physician who's starting out, and they're doing solo and they're trying to grow. Okay, you should be doing at least 30 to 50 scrubs a day. Okay, and until you get this mastered, and then you need to be calling the insurance company. Hey, I see on this claim is pending for blah blah blah. Before y'all mail it out, let me tell y'all how to fix this. or what's needed. Okay, well let me tell you what you need so y'all can go ahead and release that claim, release our money. Give me my money, give me my money, give me my money, give me my money. Okay? Now, same thing with this, same thing with that. You don't have time for social media. Okay? Social media should not be part of your world till after 5 o'clock. Whatever you do at 4:59:60, that's on you. Okay? Now, so this is what that is. So, and then you're gonna be talking to the customer service of you're gonna let them know what you see. And you're building up what? Relationship. Relationship is everything. It is. You can talk to that person at Aetna or Blue Cross Blue Shield, whatever, all the time. Be like, oh girl, hey, I just talked to you. Girl, what you want? Okay. You want me to help you? Okay. How many claims you got? Because you know I can only do 5. 5. Okay, well, you know that's it right now. You got once I help you with this 5, you got to call back on the line and get back in line. Okay? That's how they work. But you get your work done. You got to build a rapport with people. You got to know how to talk and build a rapport with people and build relationships. Okay, that helps you get your job done, helps you get their job done. They meeting productivity at the insurance company, you meeting yours at the doctor's office. Everybody has productivity. Productivity is not so much a snitch how much work you did. It's just giving you goals so you can work those goals so you can earn your money making those goals. Nobody wants to pay somebody that's going to sit on the clock. Okay, I wouldn't. Okay. Now, do we have an understanding how this works? Okay, direct link. That's what that's talking about. Okay, read number 5 for me, sweetie. What is this? This is like matching, huh?
Refer to the table in 8-1 in the handbook to list benefits of using.
Okay, skip that. Read number 6 and 7.
Dr. Morgan has 10 or more full-time employees and submits insurance claims for his Medicare patients. Is his medical practice subject to the HIPAA transaction rules? Yes.
Yes. His is subject to the HIPAA transaction rules. HIPAA is not about just swearing to privacy and quietness of a person's business. It has its titles of coverages from one insurance coverage of a job to another. It has its titles of protecting patient health information. HIPAA is huge. You have to read the whole entire book to understand the different sections and title of HIPAA. Okay, read number 7 for me, sweetie.
Dr. Maria Montez does not submit insurance claims electronically and has 5 full-time patients. Is she required to abide by HIPAA transaction rules? No.
No. Okay. She's not required to abide by HIPAA transaction rules. Okay, so we're going to kind of skip around. What is number 14? Read that. Number 14, 15, and 16.
The claims attachment standards have not yet been adopted. However, the health insurance specialist should prepare to be compliant with the requirement as of January 1st, 2016, as required under the Affordable Care Act.
Very good, very good. And number 15?
The NPI is an all-numeric 10-character number assigned to each provider and required for all transactions with health plans effective May 23rd, 2007.
Okay, very good. National Provider Identifier. Now, there is a database that has all the providers' tax ID number, all their work of what they do, and it legitimizes the physician. Now, why are they creating such a database, a NPI database for that? Is because there was so much fraud in the earlier years when I was processing claims in the early 90s, in the early 80s, mid 80s, when I was processing claims. People would make up physician addresses and fraudulently make up patient names and insurances and stuff. just to get payments from the insurance company, which was really sad. And when I worked at an insurance company, I worked at a lot of them, but one in particular that I really loved, which was Prudential. We had to do a lot of recoup of letter writing and everything. And I always had the highest productivity because it became my biggest passion for code busting people. I enjoyed that. Oh my God. It was just so much fun to me. However, it's ugly, but it was fun to me. So that's what I did. Okay. What's number 16, sweetie?
The most important function of a practice management system is accounts receivable.
Okay. So accounts receivable is everything. We just got through talking about posting payments, making sure that the person, once you post payments from the insurance company, you got to make sure that you send out the agent reports, but you send out the letters. And then you create an agent report from the software of where you do your billing and your coding and your posting of collections. Okay. So again, you send out a letter, you wait 25 days, make a phone call to the patient, make sure they got that letter. What are they going to do about the bill? And then if they're not responding and you send out another letter, you wait another 60 days, maybe on the, what do you call that? The 50th day, then you make another phone call. Okay, then you send out another letter and you waiting on what? The 75th day. Okay, so it goes on and on and on. It depends on how long you want to keep doing this. And at some point, when that patient comes to the office, the practice manager will let you know, hey, they get ready to come to the office for a visit. Come Wednesday, today's Monday. I need you to address what are they going to do about this bill. You owe $459. How are you going to handle that? Because we need you to make a payment towards this. Okay, so again, that's part of the job of a collector or a person that's doing the posting of payments, the accounts receivable. You need to work hand in hand with your appointment setter to see who all's coming in, so you can catch those who's not paying attention. They need to be paying attention at the time of their visit because they in pain and they need to be in pain. Let me not say that. They need to pay their bill. I got carried away, girl. I got carried away. I had to catch my mouth. Okay. Okay. All right. Let me take a little break here because I really need to go take a break. And then I'm going to come right back. Okay. Don't you move. Don't you move for your health information. I need to give me some water.